Hi, good afternoon. I'm here to talk about tobacco use and cessation in older adults with HIV. I'm an assistant professor at Cornell in New York City. We had the objective to study tobacco use and ask the question, what might help people quit in a cohort of older adults with HIV? It's well known and been discussed here today that tobacco is a leading cause of preventable disease and death in this population, and we sought to describe this and also test our hypotheses, hypothesizing that a greater number of quit attempts would be associated with successful tobacco cessation at 1 year and 5 year time point intervals. We also hypothesized that nicotine replacement therapy would likely be underutilized in older adults with HIV, but would be associated with successful quitting at 1 and 5 years. We conducted a retrospective cohort study of older adults with HIV, age 50 and older, who were randomly selected from our outpatient clinical practice at an urban medical center in New York City. We ultimately had 359 participants. This included English and Spanish-speaking individuals who completed a self-administered questionnaire. In total, we had 324 respondents complete the questionnaire, and overall, about 1/4, 23%, reported current tobacco use, about 1/3 had previously used and then quit, and about 42% had never used tobacco at all. Among current tobacco users, the majority, 86%, indicated a desire to quit. And of those who had a desire to quit, 90% or so had attempted to quit within the last year. But how did we do with this? We created this smoking cessation cascade. This is an Alan Johansen plot, and it shows the stepwise progression downward, ultimately with very low 1 and 5 year cessation rates. None of the cofactors were statistically associated with the outcome of sustained cessation at 1 or 5 years. So in conclusion, tobacco use was prevalent compared to the general population. Many people expressed a desire to quit. However, none of the hypothesized cofactors were associated with successful quitting at 1 or 5 years. Thank you.